Ever stop to think that the cup of joe that saves you every morning might be secretly sabotaging your sex life? That's right. That irresistible aroma, that taste that seems essential to starting the day, it could be quietly robbing you of your masculine vitality. And the worst part? You probably have no clue. A recent study from UCLA revealed something alarming. Men who consume more than 4 cups of coffee a day show, on average, a 17% reduction in testosterone levels after 3 months of continued consumption. 17%. And that's just the beginning of the problem. Have you noticed that your erections aren't what they used to be? That your sex drive seems to have decreased? That even after 8 hours of sleep, the fatigue is still there, relentless? Many men believe that this is just getting old, an inevitable sentence that comes with age. But what if I told you that in many cases, the real culprit is that seemingly innocent cup you consume every day? Today, I'm going to share with you a truth that many specialists prefer to ignore, and that the billion-dollar coffee industry certainly doesn't want you to discover. Dr. Alexander King, uncovering the secrets that conventional medicine won't tell you. Let's start by understanding something fundamental. A healthy erection essentially depends on one thing: efficient blood circulation. It's the proper flow of blood that allows the penis to become erect and maintain the necessary rigidity for satisfying sexual intercourse. Without good circulation, there's no quality erection, period. And that's exactly where coffee starts to show its dark side. Caffeine, the main active component of coffee, is a potent vasoconstrictor. That is, it narrows blood vessels. In the short term, this may even increase blood pressure and give that immediate energy boost. But when we talk about chronic consumption, we are creating a harmful pattern for the entire vascular system. A study published in the Journal of Hypertension followed 347 men between 40 and 65 years old for a period of 5 years. The results were revealing. Those who consumed more than 350 milliliters of caffeine daily, approximately 3 to 4 cups of coffee, were 42% more likely to develop erectile dysfunction compared to those who consumed less than 150 milliliters. I clearly remember a patient, Robert, 52 years old, an executive at a multinational corporation. He came to my office frustrated after trying various treatments for erectile dysfunction without success. When assessing his daily habits, I discovered that he consumed no less than 6 shots of espresso throughout the day. "Dr. Reed, I can't function at work without my coffee," he argued. After reducing to just 1 cup in the morning in just 3 weeks, Robert began to notice significant improvements in his erections. After 2 months, he no longer needed medication. Have you noticed any connection between your coffee consumption and the quality of your erections? Have you tried reducing coffee to see how your body reacts? But the story doesn't end there. Let's talk about something few doctors are willing to discuss with their male patients. Testosterone is often called the male hormone, and for good reason. It's responsible not only for sex drive, but also for overall energy, mood, muscle mass, bone density, and even mental clarity. A man with adequate testosterone levels generally feels confident, energetic, and sexually active. The problem is that excess caffeine directly interferes with the production of this vital hormone. Here is the mechanism that few know. Coffee stimulates the adrenal glands to produce cortisol, known as the stress hormone. When cortisol levels remain elevated for prolonged periods, as happens with those who drink coffee throughout the day, testosterone production is naturally suppressed. It's as if your body is constantly in fight or flight mode due to caffeine stimulation. And in that state, your body prioritizes immediate survival, not reproduction or sexual pleasure. Biologically speaking, it makes sense. In situations of constant danger, which is how your body interprets chronic stress, the last thing your body will prioritize is sexual function. A recent study from the University of Southern California showed that men who consumed more than 400 milliliters of caffeine daily had an average reduction of 22% in free testosterone levels after just 4 weeks compared to the control group. 22%. That's enough to turn a sexually active man into someone with significantly reduced libido. Charles, a 47-year-old patient, a college professor, came to my office complaining of constant fatigue and complete loss of sex drive. His wife was frustrated, thinking he had lost interest in her. When investigating his habits, I discovered that he had acquired a sophisticated espresso machine about 8 months ago and significantly increased his daily consumption. After a month of gradually reducing caffeine and replacing it with less stimulating teas, Charles reported a surprising return of libido and energy. "Dr. Reed, I really thought it was my age. I never imagined my gourmet coffee was ruining my sex life. It's mainly during the deep sleep phases, especially in the so-called REM sleep, that the peak of testosterone production occurs in men. In addition, it is during quality sleep that the body performs its recovery processes, cell repair, and hormonal regeneration. What many men don't realize is that caffeine has a half-life of approximately 5 to 6 hours. This means that if you drink a cup of coffee at 4 p.m., at 10 p.m. there's still about 50% of the caffeine circulating in your body. And even in reduced amounts, caffeine continues to interfere with the quality of your sleep. A study from the University of Michigan has shown that consuming caffeine up to 6 hours before bedtime reduces deep sleep time by up to 41%. Almost half of your restful sleep is stolen, even if you don't realize you're sleeping poorly. Anthony, a 58-year-old businessman, came to my office with a classic case. He drank coffee even after dinner, claiming that it didn't affect his sleep because he slept like a log. When performing a polysomnography, which assesses sleep quality, we discovered that although he slept 7 hours a night, he spent less than 40 minutes in deep sleep, when the ideal would be about 90 to 120 minutes. After eliminating coffee after noon, in just 2 weeks his sleep quality improved dramatically, and with that, his sexual energy as well. The result? Many men are technically sleeping the necessary hours, but with a sleep quality so compromised by caffeine that it's as if they were in constant sleep deficit, and a body that doesn't rest adequately doesn't have the energy for satisfactory sexual performance. Have you noticed that even sleeping your 7-8 hours, you still wake up tired? Have you considered that your afternoon or evening coffee might be the culprit? And there is still a fourth factor that we need to discuss urgently. If there is a silent poison for male sexual life, that poison has a name: performance anxiety. When a man begins to doubt his sexual ability, a vicious cycle is created where the fear of failure ends up generating the failure itself. It's the famous psychological problem that so many doctors mention, often without offering practical solutions. What few professionals discuss is how caffeine dramatically potentiates this anxiety. By its stimulating nature, coffee increases the production of adrenaline and norepinephrine, the same hormones released in situations of fear or acute stress. A study by the American Urological Association followed 189 men with complaints of situational erectile dysfunction, the one that occurs in some situations but not in others. They found that 73% of those who consumed high doses of caffeine had elevated levels of anxiety before sexual intercourse, compared to only 31% in the low-consumption group. Frank, 43 years old, an amateur athlete, came to me with a specific complaint. He could get normal erections during masturbation, but failed when he was with his partner. A classic case of performance anxiety. When investigating his habits, I discovered that he took pre-workout with a high concentration of caffeine in the morning and still consumed coffee throughout the day. His nervous system was constantly overloaded. After eliminating caffeine supplements and reducing coffee to just 1 cup in the morning, the difference was noticeable in a few weeks. There is another crucial point here. Excess caffeine also interferes with the sensitivity of dopamine receptors, the neurotransmitter of pleasure. Over time, chronic stimulant use causes you to need increasingly intense stimuli to feel the same level of pleasure. This can translate into difficulty reaching orgasm or less intense sensations during sex. Have you noticed that on days when you are more anxious, your sexual performance tends to be worse. Have you made the connection between your coffee consumption and your anxiety levels? Now that you understand how coffee can be sabotaging your sex life in multiple ways, I want to propose a simple but potentially transformative challenge: 7 days of controlled caffeine reduction. I'm not suggesting you completely eliminate coffee from your life. For many, this would be an unnecessary and difficult shock to sustain. What I propose is much more reasonable. Pay special attention to sleep quality, energy level throughout the day, frequency of morning erections, spontaneous sex drive. Paul, a 51-year-old executive, accepted this challenge after a consultation. He confessed, "Doctor, I thought it would be impossible. In the first 48 hours, I had a headache from caffeine withdrawal. But on the 4th day, I started sleeping better than in recent years. On the 6th day, I had a morning erection for the first time in months. And on the 7th day, my wife asked what had happened to me, because my disposition was completely different." Here's the most surprising thing. Many of these men had spent small fortunes on supplements, hormones, and erectile dysfunction medications, when a simple and virtually cost-free solution was within their reach all along. Would you be willing to accept this 7-day challenge? What would you have to lose besides a substance that may be robbing your masculine vitality? We have reached the end of this frank conversation about a topic that remains taboo for many men. Let's recap the main points we discussed today. Caffeine steals the quality of your deep sleep, even if you don't realize it. And it is precisely during sleep that your body performs most of the hormonal production and recovery necessary for a healthy sex life. Coffee potentiates anxiety and stress, two silent enemies of male sexual performance. In addition, it gradually alters your sensitivity to dopamine, which can reduce the pleasure experienced during sex. The 7-day challenge I proposed is simple. Limit coffee to mornings, replace with less stimulating alternatives afternoon, hydrate adequately, and observe the changes. For many men, this simple change represented a profound transformation in their overall vitality. I want to make it clear, I'm not against coffee itself. A cup in the morning can even bring benefits to many people. The problem lies in excess, in the automatic habit, in the unthinking consumption that has become almost an emotional crutch for so many men. You don't have to accept the loss of vitality as something inevitable that comes with age. In fact, many of my patients in their 50s, 60s, and even 70s have regained an active and satisfying sex life after understanding and modifying seemingly harmless habits such as excessive caffeine consumption. If this video touched a nerve with you, if you identified with the stories I shared, I have a request. Don't keep this information to yourself. Share this video with other men who may be facing similar challenges. Sometimes a frank conversation, based on reliable information, can be the first step towards a profound transformation. Subscribe to the channel for more content like this, where I demystify inconvenient truths that many professionals prefer to ignore. Next week, I will reveal how certain common medications, which millions of men take daily, may be silently harming your sexual health. Remember, knowledge is power, but only when transformed into action. Do you accept my 7-day challenge? Comment below your experience or your questions. I am here to help. Dr. Alexander King, uncovering the secrets that conventional medicine doesn't have the courage to tell you. Until the next video.